So our next speaker is Kristin Pego, and I have been in practice for 28 years. That's totally in a breast cancer field practice and surgery. And, you know, maybe the paradigm is changing, as you said, about the coordination of care. But Kristin is helping me work through that. She's helping me understand that I can't do everything myself, that I don't have to follow every single patient for 28 years. But it's also been a real learning moment or a teachable moment for me, understanding the chronicity of the cancer that I treat. But you don't have to do it for 28 years. I get it. I do get it. Kristin is fantastic. She's a nurse practitioner, Kristin, who came to work with me during Hurricane Sandy. It was about 3.5 years ago, and she actually came from the Department of GYN Oncology. So they're not speaking to me anymore. I can tell you that. And I think that what I have learned an extraordinary amount from Kristin, not only from the GYN part of her training, but also because she has a particular interest in internal medicine. So she goes to all the meetings, and that's why I think it's very interesting to have these relationships with your peers and with colleagues that may not work right next door to you. Although I'm so lucky that Kristin works right with me at office hours and beyond. So Kristin, tell us about what the role of a nurse practitioner is in survivorship.
Thank you so much. Again, it's like my mother introduced me. I just want to say that Dr. Rowland, that was an amazing talk, and you are an amazing public speaker. I am a good nurse practitioner, not so much a public speaker. So thank everybody for bearing with me, and for Rachel for fixing my technical difficulties.
Oh, of course, anytime. I'm happy to.
So I'm going to go on about a little bit in more detail about what exactly survivorship care planning is, and then the nurse's role in that. So we're going to discuss the importance of survivorship in cancer care and verbalize the steps to develop an effective survivorship care plan. As Dr. Rowland pointed out, millions of Americans are cancer survivors who are living with and beyond the cancer diagnosis. About 2/3 of people with cancer are expected to live at least 5 years past their diagnosis. For us in medicine, this is a pretty famous quote from a big paper that came out: from cancer patient to cancer survivor, lost in transition. The transition from active treatment to post-treatment care is critical to the long-term. If not planned and coordinated, cancer survivors are left without knowledge of heightened risks and follow-up plan of action. So what does that mean? Well, to me it means I work in a surgical practice. You know, I see patients that they come to me and they say, you know, I have breast cancer, I want surgery now. You know, I have my luggage in my car, can we go to surgery right this second? They get very focused on, you know, I need my surgery, I need my chemo, I need my radiation. And then all of a sudden they show up 6 months later and they're like, what exactly happened? And what am I supposed to do going forward? And that's exactly what this is. We're trying to let you know exactly what was done to you and exactly what is the plan going forward. How are we going to take care of you? So a cancer survivor, as Dr. Rowland said, is anyone with a history of cancer. Survivorship begins at the time of diagnosis and continues for the remainder of life. To many patients, life after treatment. What do you guys want to know? You want to know what you need to do to stay healthy, what you need to do to reduce your risk of cancer coming back. You guys are worried about, you know, insurance and money, worried about your family, and you want to return to your normal life, your life before cancer. So the goal is that a survivorship care plan is given to each patient. The care plan contains a record of characteristics of the care that you received and the effective monitoring going forward. So who's responsible for this? That would be me. There's a need for evidence-based guidelines and treatment, and how can we communicate, what is the best way to communicate with the patient and the primary care provider what the plan is. So this is I have somebody, I know it's a little bit blurry, but this is what a summary, a breast cancer treatment summary looks like. And this is what a care plan looks like. And pretty much what the details are, the components of a treatment summary, what exactly were my surgical procedures? What was my chemotherapy? What was the name of the drugs that I was given, the dose that I was given, the frequency that I was given? What kind of endocrine therapy was I given? Was I given radiation, the site, the dose, the type, any clinical trials I participated in? And then it's a two-part tool. So it reflects the treatment received and then addresses the post-treatment needs. We try and make it simple and clear, and we try and identify who's responsible for outlined actions. So if you're a breast cancer patient, your breast cancer practice is going to write for the mammograms. And then your medical oncologist will write for your tamoxifen. It's the responsibility of your primary care to follow up on when your colonoscopy is due. The goal is for this to be given people completing treatment and patients with no evidence of disease. So pretty much everyone. These should be shared with the patient, the primary care, and stored in an electronic medical record. Pretty much trying to communicate with everybody. So the care plans have specific recommendations for ongoing care, as well as health promotion strategies. When should I have my colonoscopy? When should I see my dermatologist? What can I do to lose weight? Schedule of surveillance testing for recurrence, mammogram, chest CTs, PET scans, and then including what are some long lasting effects of cancer treatment, such as pain, fatigue, and neuropathies. What are the potential signs of recurrence should be included for the patient as well. So theoretically, a survivorship visit should happen 1 to 3 months after acute treatment has completed. Preparation, the nurses or staff should really, before you come in for the visit, take an abstract of your medical and surgical history and complete this document for you. And then you have a visit with a nurse navigator or survivorship doctor or nurse practitioner. Again, this is a work in progress here. We're trying. There are many challenges to starting and maintaining this time. Each of these survivorship care plans can take up to an hour to complete for the nurse. Patients have had multiple cancers, multiple treatments. I get this all the time. I ask a patient a question and they say to me, we have an electronic medical record. They go, it's in there. And I tell them, that's like telling me it's in Google. When we sign on to our electronic medical record, there's no one concise document for us either. It's one person looking through each of the pieces, putting it together, and that is actually very timely. Technology is our best friend and our worst enemy. The electronic record, yes, everything is in there, but like they said, we're trying to create pieces so that stuff is automatically carried forward. But you have to appropriately train clinicians. If you don't put it in one exact place, it won't get carried forward. So it's our best friend and our worst enemy. Insufficient organization, resources, time, staffing, money, all those things. A simple thing like an exam room for a nurse to see a patient. Because one of these visits really should be about an hour. Funding, and then is this appropriate for all types of cancer in all patients? There are a few different models that a few different facilities have used. The shared model, which is really the primary care physician kind of driving the survivorship care. The disease specific, like Dr. Rowland said, where they're really only focusing on your disease process. And then kind of the ideal, which is a comprehensive care survivorship model where there's a place where you can go and get all the care. The surgeons, the oncologist, the nurse, the psychologist, the dietitian, a wound care nurse, and a social worker. So we're getting head to toe, mind, body, soul care. Quality survivorship is essential to help improve the patient outcomes and quality of life. And quality in survivorship includes coordination between specialists and primary care doctors, prevention of recurrent treatments and new cancers, late effects of treatment, surveillance for cancer spread, recurrence or second cancers, and intervention for the effects of cancer and its treatment. Pretty much, many patients are lost after their cancer diagnosis. They're lost, they're confused, they're scared, and they come back and they're still that way, even after treatment. And this is really an opportunity for us to educate patients on the treatment that they've received and how we're going to prevent cancer coming back in the future. To give you empowerment, we're giving you a written record of what happened and what we think you should do going forward. It's a great time for us to address health promotion, weight loss, alcohol intake, overall wellness, and it's dedicated time where we're not talking about, you need this surgery, this chemo. The vision is for a visit with a nurse or a doctor where we can just talk. And you tell me, what do you need from me? What questions haven't I answered? And what can I do for you going forward? That's survivorship from the nurse perspective.